Good morning, everybody. Welcome to another ARC webinar. My name is Shaun Keep. I formed a service company called Say So, and it's our turn actually to host a webinar today on behalf of ARC. And for those of you perhaps don't know much about ARC, ARC stands for the Age Reform Coalition, and there are currently four founding members of ARC, and they are the Hourglass charity, which is all about safer aging and stopping abuse of the elderly and the vulnerable. We've got Nightingale's Army, two lovely ladies from Chichester in Sussex, who are offering training and knowledge, assistance and support for care staff and care providers to improve care of the elderly. We have got an organisation called BCHS, that's Bettering the Care Home System, and that's run by a guy called Pat Taylor and a group of his friends and supporters, and they're trying to support care providers and trying to maintain and improve care standards, seeking solutions for sort of sustainable financing of care homes. And then there's Say So, which is mine and Paul Adams. You'll meet Paul in a moment. A speak up service that we are providing for care providers, obviously in the care sector and other sectors. But today's webinar is hosted by Say So. So as you can imagine, it is about the subject of speaking up. It's the fourth in an ongoing series of webinars that after we launched ARC in April. We did three, I think, in 1 week in April, and this is the fourth. And the idea around ARC is to, develop and improve and support everyone in the care sector so that we can give the best possible care and support and care delivery to those receiving care. So the title and question for today's webinar is this: Is it a brave step for care providers to encourage and support their staff to speak up about concerns at work? We're trying to explore the issue of speaking up in the social and nursing care sector. What factors impact upon staff? What factors impact upon care providers or care managers when staff make reports of concerns in the workplace? We've got a fantastic panel of professionals. I'll introduce you in a moment, and they will give some information about their background, etc. But we've got Judith Milburn, Rachel Adamson, Sabina Kelly, and Paul Adams. So if we can go to Sabina, well, could you give us perhaps 1 or 2 minutes background introduction of yourself, please?
Yeah, good morning, everybody. So I've been a nurse all my working life from the age of 17 and a half. I've been a director of operations for a care company. I've been a very senior sister, and I'm now involved. I run a care home, and I'm now involved in the adult care sector by doing a lot of government lobby because people aren't listening, and that's what I do.
Thank you, Sabina. Rachel, do you want to give us a little backstory, please?
Good morning, everybody. My name is Rachel Adamson. I'm a HR professional. I have been for 30 years. I've worked in many industries, including health and social care. I do have my own company called Northern Star HR and Wellbeing Solutions, and I care passionately about the wellbeing of staff and have done throughout my whole career. I'm also delighted that I've recently been appointed as a part-time Freedom to Speak Up Guardian for the NHS. But more than that, I've witnessed over my career the importance of staff speaking up. I have had some lived experiences myself of being in situations that have been very uncomfortable in relation to stuff that I've discovered and had to pass on to senior management, etc. So I am passionate about that happy workplaces. I've got staff who are able to have a voice and who are able to raise concerns, and I'm delighted to have been invited today.
Thank you, Rachel. Thank you. And Judith, could you give us a bit of background for yourself, please?
Yeah, good morning, everybody. I've been a nurse for 40 plus years, and I've managed care homes I manage domiciliary care, a nurse agency, so but recently had to put my own mum into a care home, so I can see it from, and my dad was in a care home, so I can see it from all aspects really. And again, I'm passionate about making sure that people have good care, but that staff feel confident and comfortable enough to make a concern without being penalised. Because like Rachel said, I've actually been in a position where I raised concerns and, you know, I was the one that ended up getting penalised. So yes.
Wow.
And
okay.
I actually met Shaun when I was doing an audit in one of the homes that he, or the services that he is involved with. So yeah, so thank you for inviting us.
Thank you, Judith. Very interesting. A lot of wide variety of background. And Paul, could you introduce yourself, please?
Yes. Good morning, everyone. My name is Paul Adams, and I'm one of the co-founders, along with Shaun, of a Speak Up organisation called Say So. My background is much like Shaun's. I retired from the Metropolitan Police in 2014 after 32 years police service. A very enjoyable 32 years, not without its challenges, but very proud of what we did over those 32 years. The reason that I've always been an advocate for speaking up. I've had many sort of lived experience, both in the police service and outside the police service, where speaking up is so important. I currently, since my retirement, I have been the carer for both my mother and father, and my mum with early onset dementia, my dad with serious disabilities, but maintaining his sort of capacity to make decisions. So I'm really at the front line of the care system at the moment, and in the last 12 months, I've unfortunately had to put my parents into a care home. So again, they're in two different care homes. So that frontline experience has been really informative, and I think very much something that we can bring to our organisation. Say So was initially set up in 2017 along with Shaun, having reviewed, with a safeguarding hat on that we had, we reviewed a number of investigations into the care sector where different levels of abuse had occurred, and one of the common denominators that we found going back down the timeline is people knew what had gone on, but they didn't feel confident to speak up about it. And this was really the stimulus that we needed to actually try and do something. Because when we reviewed the situation, no one really was doing anything to create what we felt was a better environment to speak up, significantly being independence and impartiality. So that's myself. Very pleased to be here. I think ARC is doing some fantastic work. Very much enjoy being with the group that we're with, and hopefully looking to hear some of the views of people out there around what's going on in the Speak Up world.
Okay, thank you, everybody. Now, how we're going to run this is I've got some questions that we're going to start with, but people who have tuned in, and I'm grateful for everybody who's attended. If they have any questions, then please put it in the Q&A box on the system, and I and Penny, my helper here, we'll pick them out, and if we have time, we'll ask the panel those questions as well. We've got a set few questions that I think are all relevant, but let's see where we get to. Okay, so I think to start us off, you know, obviously the title is this: is it a brave step for care providers to encourage and support their staff to speak up about concerns at work? I'd just be interested to hear everybody's views around that, but let's just talk about the background to this now. So why is it, do we think, that so many health and care staff actually fear speaking up? Why do they fear it? What is the issue there? And I know, Sabina, you've done some research around this. Can I turn to you first and just say, why do you think so many care and health and care staff fear speaking up?
Well, I have done some research, and there are common themes running through. So if I look at my notes, don't tell me off, because I had to write it all down. I can't do it from memory. So the challenges that, can you hear me, by the way, everybody?
Yeah.
The challenges that face people who want to speak up. The current theme appears to demonstrate barriers from management. So after drilling down and looking at the research, I wanted to question why. What is it that management, that there are so many factors prevalent to this? So the issues for concern, amongst others, are abuse, missed or wrong diagnoses, poor clinical judgment, rule breaking, and failure to follow policies. So in theory, concerns raised show result in preventable and actionable outcomes in order to improve standards of care. And we can all pluck out a reason right here and now about why silence is preferable. So I would suggest in some instances that managers are reluctant to listen to concerns raised. So why is this? What's going on? Surely it disarms them from legislative and expensive court outcomes brought by families who sue and errors which can result in a dangerous level of situation. So to enter the debate, I suggest there are several reasons for this. Many won't agree with me. Some it will ring very resonant bells. So the first point was power. Management make decisions at a high level. Why would they appreciate a subordinate even questioning what they've decided? I think, Shaun, did you say it was professional arrogance?
Yes, that's something that I've come across, is that people at high levels have spent their whole career getting to that high level, but then when they get there, I think some of them take the view that they know best, and they won't listen to somebody who has only got 5 minutes experience as far as they're concerned, and yet that person may have real operational issues to discuss with them.
So they also may not have a good knowledge base, especially in the clinical area, and feel threatened. They may be afraid of CQC scrutiny. They may be afraid of not hitting targets. They may be afraid of getting a bad reputation in the work environment. They may be afraid of upsetting the apple cart, e.g. upsetting consultants and doctors. So in theory, raised concerns should show preventable and actionable outcomes to improve standards of care. I would suggest that as you can hear, that managerial organizational culture, whether it be government, and we've all seen a lot of this, haven't we, in the last 3 or 4 weeks. We've seen people raising concerns about cost of living. No one is listening. They're just focused on taxes. They're not listening. Healthcare or the police, they must change this fear culture as a matter of urgency. We had the Everard girl. Everybody knew about that policeman as a matter of urgency, and they must act swiftly on the concerns raised. We need to change the mindset of senior management. We need to celebrate whistleblowers who bring their concerns to the fore, and not to ostracize, bully, and even in some circumstances dismiss. And in these times of austerity, when people are so desperate to keep their jobs, to pay their bills, we can see what's happening. We can see it like a pane of glass. And I repeat, not reporting costs lives. And if anybody wants to contact me and say, talking related rubbish, or we love what you said, I'll give out my email now. It's Sabina Kelly, SABINAKELLY 73@gmail.com. That's Sabina Kelly 73 at googlemail.com.
Okay, thank you, Sabina. That's a real comprehensive answer to that, and I'm grateful for the research that you've done. Thank you. Coming back to the question that were asked, though, for another panel member, why do so many health and care staff fear speaking up? Rachel, do you want to say something about that? I know you've got some experience of that sort of thing.
Yeah, I think a lot of what Sabina said there is absolutely right. I think there's an issue whereby there's a bit of a power imbalance and people are frightened, particularly in the care sector. Unlike a big organisation like the NHS, which has got, you know, that's huge, care organisations are often relatively small in comparison, and the management, you know, might be more, and the culture might be more like a smaller family environment where people feel that if they start upsetting the apple cart, then they're going to be out of a job. And unfortunately, as Sabina's just said, people have got mortgages to pay, they've got bills to pay. People in the care sector often don't get paid greatly for what they're doing, sadly, and that job's important, and therefore to raise a concern to senior management, who might be the business owner, is a massive thing to do in terms of if they've got short service, they might not have any employment rights in terms of HR processes and procedures, and they might not have the money, they might not have a union that they can go to in terms of taking something to an employment tribunal, for example. And therefore they are very often in an impossible position, and therefore they just sit tight and think, I need to keep my job, and I will do my best doing the role that I'm doing in my own little bubble, but I'm not prepared to go higher and say anything further, which is absolutely desperately sad, isn't it? Obviously the CQC is a you know, a place where people can go and raise a concern, but again, there is the fear that once it gets known that somebody's gone to the CQC or indeed has gone somewhere else, then there's an issue there that they're a troublemaker. I'm not a fan, and I've discussed this recently with one of my new lovely colleagues within the NHS, not a great fan of the term whistleblowing. It's got negative connotations. At the end of the day, anybody that speaks up is actually doing an organisation a huge favour, and I'm sure we'll come into that, you know, we'll discuss that further as we go through the webinar. Yeah,
thank you, Rachel. Judith, is there anything from your side of things that you've seen that you'd like to add?
No, I mean, I agree with both Sabina and Rachel, and I mean, as I said, I've personally raised concerns myself when I wasn't a manager, when I was a nurse in a nursing home, and raised quite serious, what I thought were quite serious concerns. You know, after that, I found myself, you know, there was just little things that I would be excluded from. You know, you were certainly not part of the kind of like not part of the clique. And eventually just, you know, I left because life got unpleasant, you know, and it was very sad because all the concerns that I'd raised were actually very relevant, and you know, it was about racism actually. It was a lot of years ago, you know, and I don't think that things have got any better really. As a, you know, when I'm going around different care homes as well, I see people, speak to people, and you know, sometimes I think it's a culture within the home, you know, that staff that have been there a long time and new staff come in, they don't want to rock, like you say, they don't want to rock the boat, you know, so they end up leaving. And you know, the culture doesn't change. So yeah, I definitely think there's a need for companies to be and services to be very transparent.
And isn't that sad that, you know, obviously you're a committed nurse, you want to do the best thing you can, and yet you felt you had to move on. So that's a loss, isn't it? It's a net loss without a doubt. Okay, Paul, do you want to add anything from your perspective to what's been said?
Yeah, no, I think you know, Rachel and Judith and Sabina have covered some areas of it, you know, extremely well. And all I would say very briefly is that this is such a massive area why people don't speak up. And I can speak from lived experience as being that person that has spoken up and hasn't spoken up. And it's tough. It's really tough. And one of the things that for me is dealing with the care sector specifically. You know, as soon as you put your head above the parapet, and look to scrutinise or question what's going on, there is an environment that changes, a pattern of behaviour that will change, because it's instinctive for the leaders to protect what is their care organisation. Now, you know, just only 2 days ago, I had something that I spoke up about my dad in the home, and the reaction from the care manager was absolutely fantastic. You know, it was quite a serious issue, marks on my dad's skin. I was anxious about the conversation prior to the conversation. I knew I needed to have the conversation, but I had the conversation, and openness and transparency that I haven't seen before in some of the work we do was there. And I had to recognise that. We got to the bottom of it, and it was to do with when my dad was being put in a hoist to get back into bed. So there was a reasonable explanation for it. Now that could have gone completely the wrong way. When we hear care leaders say, "I know my staff," this is about personalities, and everybody is different. For one person that may be able to speak up, there's another person that may not be able to speak up. And I think one of the things that where we get the progress with our Speak Up organisation is we go to the organisation and start to build those relationships, build the confidence to get people to say what they want to say and that they feel they can't say. And that's a significant difference. So it's a very, very big area. I'd like to focus on the care sector piece at the moment, because I think the staff in the care sector and what they do to look after vulnerable adults is very unique in its own way, because you're not only looking after the individual that works there, but you're looking after one of the most vulnerable people. It goes wrong. It could go wrong for the worker, but it could also go wrong for the person they're trying to look after. And that's very significant.
Okay.
So yeah, a great area, but that's fine.
Thank you, Paul.
Okay.
Thank you, Paul, and thank you everybody for that. I just want to take this. I think we've touched upon this a little bit, but I just want to dig a bit deeper into this. Do you think, you know, the fear of speaking up is worse in the care sector than perhaps others? Some of you may have not worked in other sectors, but certainly the feeling I get that might be the case, but I'd like to hear your views. And also, what about media and social media? Does that make the fear of speaking up worse? Is the fear transferred by word of mouth, or are people, you know, listening to what's on the media, what's in social media about speaking up, and that, you know, cements their feeling around, hey, something will go badly wrong if I speak up? Do you have any views on that? Sabina, what do you think about that?
I think it's, again, like everybody on the panel, I've had lived experiences. I'm supporting a friend of mine who's a senior sister. She spoke up about safer staffing. She went to an interview with HR, and her options were dismissal or demotion. I mean, it's absolutely appalling.
Yeah.
Because she was so concerned, because obviously there is a national problem with safer staffing. But management just don't want to hear. They just say, "Oh, national problem." In the meantime, she's worried about compromising her care. So in hospitals, and I mean, for the older fashioned nurses like myself, you wouldn't dare speak up to a sister. And Shaun and I were having a conversation the other day, yesterday, that when I was at King Edward's, which still happens, there was a matron, and she would come up and she would glide literally down the walls, and she'd say to Sabina, "How are things?" "Oh, absolutely fine." Now, we would be clinging by our fingernails. We were so short-staffed and whatever. We would never admit that things were fine. Yeah. And Shaun, you also backed that up in the police.
Yeah, and yes, just going on from that, Sabina, when I first joined the police, and I'm sure Paul can remember this as well, we were told if ever we met a uniform, or certainly an inspector, we were to greet them with "all correct, sir," because they were all men in those days. "All correct, sir," and that was how we were meant to greet them. In other words, telling them everything's fine. We had no option. That's what we had to do. So yeah, I think there is what Sabina and I think agree with. There is this hierarchical expectation that when you're talking to anybody in management, "Oh yeah, everything's fine. We're on top of it. We're managing. Don't worry, it's fine." Whereas actually that you know, when you dig a little bit deeper, just a little bit under the surface, everything's not fine, you know.
Just to answer your question, Paul, so I've been involved in the NHS with people not speaking up. I've been a director of operations. I've run a care company. I've run a care home. Same issues. So I think it is exactly the same. With a care company, you're worried about head office coming down on you. You're worried about jobs, etc. In the NHS. You're worried about management. So I think it's exactly the same. And interestingly enough, I know it's old stuff, but I looked at research at Gosford Park Hospital. I looked at the Francis report, Staffordshire, and I've looked at Ockenshaw, which is very recent. Now, don't tell me that 9 women died and 100 babies died and nobody knew what was going on because they weren't. But how can you be so afraid to speak up and see patients die in front of your eyes and babies? 100 babies, 9 women, because they wouldn't give Caesar. I'm sorry about my cat.
I think the cat's just trod on the mute button or something. But that was very interesting from Sabina.
I think, Shaun, just very quickly, I think there is a difference in the health and care sector. I think because you're dealing with, I think one of the questions that will come to a manager or a leader's mind is, are you questioning the way I'm looking after a vulnerable person? That's a very different dynamic to someone that is apparently looking after their own well-being as an employee. You know, the role is to look after vulnerable people, and in the NHS to care for people and make them better. And I think that's a big question to ask, and that's where a lot of the fear comes from, because no one wants to be told that they're not caring enough for someone or they're not looking after someone, especially when it's their role.
Yeah, no, indeed. So just kept moving on. Rachel, the question was, and I'd like to hear your views around it. Do you think social media and the sort of sensationalized reports that happen in the media about what goes wrong in whistleblowing cases, do you think that puts people off?
I certainly think it has done in the past. I think the situation is getting better now. I think when the Winterbourne scandal happened now many years ago, I think people were absolutely devastated by. I think the penny dropped with people that this is actually what could and is going on in some care settings. Luckily, hopefully, the minority of care settings. But I think people are seeing much more now on social media and across different platforms, and people's expectations have been raised now in terms of you know, not wanting their relatives to be treated in a poor way. So I think we're in a better position than we were several years ago, a decade ago. As I said earlier, I think the term whistleblowing is unhelpful. I think that needs to change, and I think that needs to happen from a government perspective. I think the protection of employees needs to improve in terms of giving people more employment rights if they do suffer a detriment. And certainly within the NHS, that's a word that we use a lot in terms of speaking up, that we don't want our staff to suffer a detriment. And I do think that this role of speaking up within the care sector is absolutely vital. But as Shaun is well aware of my views, I think it needs to be broadened out into many sectors, because it's not just about care. It's about somebody alerting that somebody could have committed fraud, taking away money, and there's all sorts of alerts and concerns that can be raised. But I think we're in a better position than we were certainly probably about 10 years ago after the Winterbourne scandal.
Okay, thank you. We've got a couple of comments coming in, and I'll just read them out. They're very interesting. One from an anonymous attendee, and I respect that entirely. It says here, I work as a carer and have raised several concerns with my manager. These include bruising, rough treatment, and issues around the carer not being person-centred. I've had my concerns minimised, told I was overreacting and or paranoid, and told I don't know anything. As a result, I've had shifts taken away from me and been told categorically that CQC never does anything. It's rife in the sector, and because they are so short-staffed, they ignore concerns. a bullying and silencing culture. Well, thank you very much for that. That's really interesting. It shows that there's clearly work to be done here. And then another comment from Anne. Thank you, Anne, for this. I worked in the NHS for 32 years. I was a healthcare assistant in an equalities and an equalities officer for a trade union. Raising concern was never encouraged. There was little union support. Staffing levels on some wards were dangerous. Staff discouraged from putting in incident forms. This was 12 years ago. Are we now working with trade unions to give support for someone raising concerns? I don't like the word whistleblowing. I've seen it from another perspective where the malicious allegations are made. We need an open door from line managers for staff to raise concerns. Yes, I certainly agree that we need to make sure that staff are welcomed actually when they raise a concern. They're only raising a concern after all, in my view, because they are passionate about what they do and they want to do it in the best way possible. Sorry, Rachel, do you want to say something? Sorry, you got your hand up.
Yeah, I think all of those views are absolutely valid. It's really sad to hear what some of the people who were on the webinar have actually just stated. But, you know, one of the things that certainly within the NHS that we're really keen to do when somebody does raise a concern to one of us as a Freedom to Speak Up Guardian is that we thank that person for actually raising the concern and actually, you know, being grateful that actually they have come forward and been brave enough to raise whatever that concern may be. And whilst things might have been poor 12 years ago in the NHS, and that's really sad, I'd like to hope that certainly with what we're doing with Freedom to Speak Up within the NHS, that we have now got a process in place to allow staff to independently raise concerns so that the Freedom to Speak Up Guardians can actually go to the main Guardian office if we're not getting any joy from the trusts that we're working within. So I think we're in a better position, but we need to thank people, whether it's in the care sector or anywhere else, for coming forward and raising a concern. Yeah.
Okay, thank you very much. Judith, is there anything you want to add to that? And the question was, has media, sensationalized media and social media reports, do you think those have served to put people off speaking up?
Yeah, I do in a way, and I think it's because you never get really, when you see things about, you know, care homes, sort of negative things, you never get the positive side from the media. It's always, you know, when you see a programme about the care home, it's always because it's bad care, it's bad, you know, this is bad, that's bad. And I think that gives people a perception about care homes to start with. So looking at it from, if somebody wanted to place their relative, and just as an example, as I said, we've just had to put my mum into a care home, and my sister doesn't work in care, but she met somebody whose relative had been in that care home, and they said, oh, it was absolutely dreadful. So when she went in, because I live about 95 miles away from where my mum's in a home, my sister went to view it. So she immediately went in with that perception, because she then read some of the reviews on the, you know, on general websites.
Yeah.
And, you know, some were good and some were not so good. But I think she went in with that general perception that this is going to be awful. So now every time she goes in, she finds fault with something. And I was in yesterday, and, you know, I did raise a couple of sort of things with the manager, but I'd also spoken to the manager before that and said, you know, what job I did and that. And, you know, she was quite happy, as you said, Paul. You know, she was absolutely, you know, said, if you don't tell us, like, we're not going to know, we don't know how to put things right.
Yeah. Yeah, no, that's valid, totally valid.
But I think from staff's point of view, you know, when you read about things on social media of people that have raised concerns, and they're, you know, they get loads of negative comments themselves. So,
okay.
Yeah, I do think it has a lot to do with it.
Okay, thank you. Paul, sorry, Rachel, there's a specific question for you. It says, come in from Peter Linley. Thank you, Peter. What term would Rachel Adamson suggest to replace whistleblower? Now, I've got some thoughts about that, but I'd like to hear what can we call them?
Well, I mean, I think speaking up is a good term, because that's exactly what a person's doing, aren't they? And yeah. You know, I think that's not a bad term for us to use. I just think we need to get away from whistleblowing, because it has got such negative connotations. Really sorry, I probably can't be any more creative than that, but yeah, there just needs to be a drive away from whistleblowing. It's damaging. It is damaging.
I entirely agree, and I think actually whistleblowers show more bravery and leadership than many of the leaders, and so they are being leaders at the end of the day. You know, Paul, have you got any thoughts about what we could call whistleblowers?
Well, I think it is a tough one, but you know, for me, whistleblowers, you know, when that's happened and they have been identified as that individual, I think, you know, their journey is being dictated. They will be treated in a certain way, which is not acceptable. They will not be able to say things without being taken seriously. But from my point of view, I think going back down the timeline, whistleblowing for me is crisis. That's when it's all gone wrong, and we can't do anything. But if you can get in earlier and get people to talk to you earlier, to speak up earlier, then we could, in theory, stop situations where anyone ever has to whistleblow. You know, it's a utopia and potentially won't be achievable. But you know, you need to get people to speak up early. You know, many whistleblowers that I've spoken to, you know, there has been opportunities to speak up. But there hasn't, and it's become a crisis. It's become overwhelming, and they become that individual. And then, unfortunately, we see in the media, going back to your previous question, how they're almost targeted and treated in a certain way, which is not acceptable. And that's why we're having these sort of conversations. But as far as a name for people that's speaking up, along with Rachel, I think an individual that's spoken up is more than appropriate. You know, we will stop saying whistleblowing eventually, because hopefully those occasions when it has become a crisis and everyone's life has been turned upside down and there's really serious abuse to be reviewed, will diminish. And you know, I think what the Speak Up, you know, the Freedom of Speak Up Guardians do in the NHS is fantastic. They do some absolutely fantastic work. We've spoken to some of the people that started it a number of years ago, and it is doing some great work. But I still believe there's more we can do. There is more that we can do, and we've got to keep revisiting this. And what the professionals decide to name this as, I think will be a conversation that will go on for a long time. But we just need to get people that will speak up freely and feel confident to say what's going on.
Okay, thank you.
You know, I think, can I interrupt just for a second? Yeah. I think I agree so much with Rachel. Whistleblowing belongs to the Victorian era. It evokes images of policemen in little funny hats blowing their whistle when there's trouble.
Yeah.
And so much of the semantics and the narrative in social care, I think, you know, I was on Helen Whately's ex-care minister advisory panel, and I really begged them to change the terminology of social care. It belongs in the workhouse. Yeah. And I said, if Tesco's and everybody else can rebrand, why can't social care? So why can't social care be health and wellbeing initiatives as opposed to social care? There's nothing social about it, and in a lot of cases, care is lacking for various reasons. And whistleblowing is a derogatory term, and it's also media savvy. It sells news.
Yeah, absolutely.
So I don't know, I'd have to put my head around it and maybe discuss this with Rachel at a later date on what other terminology we can use. But as I've said, there is so much in health and social care where the narrative is just appalling. and needs like the culture to change and more innovative semantics to be put forward.
Okay, thank you. Yeah, very interesting. Okay, so sort of moving on a little bit, I think we've all come to sort of an agreement that you know, there is a fear factor and there are problems, but what does that mean? Does that mean, I think Paul has touched upon it a little bit, but do the panelists agree that, you know, if the care staff are unable to speak up, that there are missed opportunities to maintain standards and prevent failures? Is that a consensus? What do you think? Rachel, do you think that's true?
I'm not entirely sure, really. I think maybe other people might be able to help better with
Okay.
that, Shaun, in terms of.
Okay. What about Judith? Do you think the fact that care staff can't speak up or feel it's difficult to speak up, is that a missed opportunity to make sure things are correct and are working properly?
Yeah. I also think it's quite difficult at the moment, because a lot of care providers are using quite a lot of agency staff.
Yeah.
So, you know, and there's nothing wrong with using agency staff, but sometimes they're in and they're out.
Mm-hmm.
They're not seeing what's going on, because sometimes it's not just something that you see on one occasion. Sometimes it's something that you see you're sure about, and you think, oh well, I'll just, you know, that might just be that person, you know. And but if you're in agency staff, you're kind of like, you're going in, you're going out, you're not really always seeing the rest of this, seeing the bigger picture, you know, because just maybe in for one day. Sometimes as an agency staff, I mean, I used to work as an agency nurse, and sometimes, you know, you kind of like, you just want to go in, do the shift and go back home again. You know, you don't want to be involved in politics. You know, so I think there is a lot of missed opportunities, but I don't think it's entirely down to all the staff's fault. I think it's just the way things are going at the moment in health and social care, with the lack of staff as well. Okay,
thank you. Paul, what about you? Do you think that there's missed? I think we'll know the answer, what you're going to say, but I'd like the audience to hear around, you know, missed opportunities.
Yeah, I feel that there are missed opportunities all the time in relation. If you don't have a pattern of behaviour that people are free to scrutinise and ask questions and have good relationships with their managers, then you're always going to miss opportunities. You know, and again, there's a lot of things going through my head about the current situation with my dad in a particular home with his needs. You know, there are missed opportunities, but I'm the eyes and the ears that are in there all the time. And you know, the way they've reacted to some of the missed opportunities has been great so far. I'm very conscious that, you know, everybody I speak to looks exhausted. I'm very conscious that the bells are always ringing for the other patients. I'm very conscious when they know I'm there, they come to me and they've got their eyes wide open as if to say, and what are you going to moan about now? And what are you going to say now? So it's a really tough environment. But, you know, in my mind, there is no doubt that opportunities to improve the standard of care are missed if you don't have a particular type of culture where people aren't afraid to say, look, I'm not comfortable with this, I'm not happy with this. But again, the uniqueness of this sector, you know, my dad, for example, stayed 6 weeks extra in a huge hospital in the West Country because not because they couldn't find him a place, but because the care homes were all operating understaffed. You know, 60-bed care homes only had 20 beds occupied because they couldn't take any more patients because they didn't have the staff. So those are all the issues that will help the environment to be suppressed, where people can't feel confident to speak up and say, look, I'm really not comfortable with this, because, you know, within their world, they feel they're going to be someone's going to come back with them and say, you question me, you know, we're doing our best, you know. But that sort of culture is not what's going to improve standards.
Okay, thank you. And we've got another question here around, you know, okay, well, I think we've realised that it is difficult then for care staff to speak up. Many care providers that I've seen have their speak up policy on a wall, a poster that says, you know, call the head of HR on this number or email HR on this email address. Is that sufficient? And you know, how can care providers make their staff feel safe to report their concerns? You know, what more can they do? I've got some answers for that, but I'd be interested to hear what the panel think about how they can actually make their staff feel safe and confident to report. Rachel,
can I just throw that one out there very quickly, very briefly?
Yeah.
Hopefully it might stimulate the conversation. I feel what is very significant is that you need independence and impartiality, genuine independence, genuine impartiality around the infrastructure where that reported concern is going to go. I think there's a clouded area where people think they're independent, but they're actually not. And your example, Shaun, is a typical, great example. You see it on the, and I have many pictures of them across the country where the it is at the care home. Please contact so-and-so, so-and-so, and the address is at the care home that they're working from. You know, that's not independent. That's not impartial. That won't make people feel confident to speak up.
Yeah, thank you. Rachel, in your new role, do you have a view around that? And I know you're not speaking on behalf of the NHS, but it'd be interesting to hear what you have to say about how you can make people feel safe and confident to speak up.
Okay, well, I mean, I'm interested in the conversation, the comment there about HR professionals and that they're the people that people need to go to. As we know, in every industry, there's good and there's bad, and sometimes HR, rightly or wrongly, is viewed as being on management side. So I don't necessarily think HR should be the avenue of people to go to in a care sector organisation, if that care sector is big enough to have a HR professional of their own. Don't get me wrong, there's lots of great HR people out there that will listen to staff, that do care, that are very ethical, that, you know, believe in having a moral compass. But you know, HR's role very often as well is to protect the organisation from litigation, to protect the organisation going to employment tribunal, etc., etc. So I absolutely agree with Paul. I think there needs to be some independent channel. Obviously, as I say, in the NHS, we're very lucky because we've been, in a sense, trailblazers in terms of how we do it. As I say, we, you know, as Freedom to Speak Up guardians in the NHS, we have got the ear of the Chief Executive Officer, we've got the ear of the Chair, and actually, if we don't get anywhere with that, we then go to the Guardian's office, and we can go above all of those people to keep our patients safe, and that's what we will do, and that's what my colleague and I will both do if we need to do that. So I absolutely agree. It has to be an independent person, and how that is then actioned within different sectors, and the care sector is obviously the next question, but I absolutely agree, Paul, it has to be somebody that's outside of the normal structures.
Okay, thank you. Judith, do you have a view? Anything more you can add to that?
No, I totally agree. It needs to be independent.
Oh, wow. Okay. So that I'm just going to read some more comments. Peter again has said the abuse of people in care is not a new problem. Long before the advent of social media, people who raised concerns or wanted to raise concerns about care were terrified of doing so. It often led to the end of the career, and you know, that's sad to read. But I think we all understand that. The reason I wanted to ask the question about social media and the media is that I think that what's happened is social media has almost magnified the problem, because every time you hear about something around a whistleblower going wrong, something around somebody whistleblowing, losing their job, etc., thousands and thousands more people get to know about it than perhaps years ago, for instance. And I think that message has just fermented and got worse, basically. So coming back to, I think what we started to talk about was, is it a brave step for care providers to encourage and support their staff to speak up about concerns at work? Or does it make just good business sense and good safeguarding sense So I think I'll come back to the panelists and just sort of say, do you think it is a brave step, Rachel, for care providers to actually ask their staff more or do more to get more information from their staff about what's going on? Or do you think it makes good business sense at the end of the day?
I think it is a really brave step, but I think it's an absolutely needed step. And I think, you know, if you're listening to your staff and you've got an engaged workforce, you're going to have a successful business, aren't you? And that goes across, you know, across the piece, doesn't it, really? So I think, you know, just because you're a business owner or you're a senior manager doesn't mean to say you've got the answers to everything. So I think you start listening to your staff, you know, and actively listening, not just listening, but actively listening to what they've got to tell you, because in all sorts of ways, they will improve your business performance. And speaking up is just one way of becoming a provider of choice. You know, we would all want our relatives to be in a care setting where they are being absolutely looked after until potentially end of life, and being given that dignity of care that we would all expect as human beings. So I think absolutely vital that you know, that care providers, you know, open up to this as something that's really important to do for business success. Yeah.
Okay, I hear that. Excellent. Judith, would you want to add anything to that?
No, not really. Yeah, I think it is vital, and I think the services that, you know, if I go into a service and they're either using an independent service or, you know, that they're very open and transparent, for me it's so much better, you know, because you know that there's a culture of, you know, they can trust the manager that something's going to get done about it, and you know, that's what staff want to hear. You know, I mean, I've never been into a home where somebody said, no, I've never had any concerns. You know, but how, you know, how management deal with it is vital, really.
Yeah, and in your role, Judith, I know you do mock inspections, but you know, to help care providers prepare for CQC inspections. Do you know what the CQC thoughts are around speaking up, etc.? Is there any particular questions they ask, you know, when they go into a care home?
I think when obviously they'll just speak to staff and just ask them if they've got any concerns, but you know, staff may well not want to, because although they don't name them in a report, you usually know which staff they've spoken to, you know. So I don't think anybody really wants to have it written down that they've raised a concern, you know.
Yeah. So anonymity is a big issue then, I think, isn't it? Staying anonymous and keeping safe.
Yeah, I would say so.
Okay, interesting.
I like that, as I say so, Judith.
Yeah. Sabina, I noticed you got your hand up. Is there something you wanted to say?
Let's start on Rachel's thing about HR. So I'll give you the points now. I do not understand where the HR role came into the nursing profession. I respect everything that they do, but with grievances, and I told you about my good friend, the HR was new enrolled, handed her a scrappy piece of paper saying her options were this and this. You need someone that understands the care role and the clinical role, someone that really knows what the pressures of safer staffing are, how it can affect your mental health, someone who understands what losing 15 residents in COVID is, what it does to you. So that's that. By a company being brave enough, there are several things. For a start, it's CQC compliance. When you get your CQC inspection, we'd love to see transparency. And if you sign up to someone like Say, it's a real feather in your cap. But it's also good if you engage with your staff. You can use their concerns as a matrix and a measuring tool. So you can look at what's working and what isn't working and start actioning. And then you don't get a crisis. It's really not rocket science. And if you have, when I was a director of ops, you know, it was and when I was a senior assistant, it was open door. And I used to love it when the girls used to come and say, you know what, Sabina, there's been a couple of medication errors, we're worried about this person, whatever. And I would put it down to the client's home and have a look and then follow the because she hadn't taken on board training. But before anything dangerous happened, those girls would alert me.
Yeah.
And I could then do something about it, give more training, give a bit of support. Well, yeah, but also give a bit of support to say, I don't think you quite understand this. And then they'd say to me, you know what, Sabina, I don't really get it. Why do I have to put not given? It was as simple as that.
Yeah. So staff development and training at an early stage can avoid, as I think we've been saying, can avoid those serious failures later.
Again, I'm very active on LinkedIn, and when I see abuse and this, and what's really, really worrying me at the moment is all these care homes giving out evictions. I mean, you evict someone out of a home for not paying rent, not because they can't meet their care needs, but anyway, that's
okay. Thank you.
that's it.
All right, thank you. Only got a couple of minutes left. I'm going to just a couple of things from Fiona Davis. She says, I agree, Paul, it should be impartial as HR belong to the organisation. And I think we've sort of all agreed with that, really. Anne said again, missed opportunities, of course, unless the culture becomes more transparent. We need regular staff meetings where staff feel comfortable and supported to disclose. Let's nip these issues in the bud and change together. Well said, Anne. You know, we're all for early reporting, making staff feel comfortable in some way to get that information out. That's brilliant. So I think we can draw this to a bit of a close, and I think have well, not a yes or no question, I suppose, but do we think then by having a speak up policy in place, it makes good business sense and makes good safeguarding sense? I think that's what I'm trying to get out of you. If we have a policy in place and a process in place where staff feel safe, is that going to make ultimately the business better and individuals safer in their care? It's a quick yes or no, really. What do you think, Paul?
Unequivocally, yeah, absolutely. It's got to make good business sense because you get a better view of your organisation, don't you? You understand the staff, you understand what you're trying to achieve, and it most certainly does. Okay.
Judith, what do you think?
Yeah, totally agree.
All right, thank you. And Rachel?
Yeah, healthy cultures, you know, just improve every business success, don't they? Whatever sector it is, so absolutely.
Okay. And Sabina, you can have the last word. You have the first word and the last word. What do you want to say?
Absolutely, definitely. Providing it works, and it's not just tick box.
Okay. Yeah, no, indeed. Thank you very much. So that draws this webinar to a close. I hope it's been useful for everybody. Thank you, everybody, for attending. Thanks for your comments. I know a few people there made those comments, so thanks very much. And thanks to all the panelists. I'm really grateful for the time that you've given us today. But I'll draw it to a close there. Thank you very much.
Thank you, Shaun. Thank you, Judith, Rachel, Sabina.
Yeah, nice to meet you all. Bye-bye.
Thank you.